Over the last 2 years, with the assistance and the input of over 100 colleagues, we've put together this report, The State of Oncology in Africa in 2015. The report is unique. It's unique in that it was written by Africans working in Africa about the situation in Africa in collaboration with international colleagues who work closely with them on the African continent. It presents a very depressing and a very deplorable situation. There are many patients, cancer patients in Africa, who only seek medical care, our idea of medical care, when the disease is too advanced to do anything rather than provide palliation. And yet there are 30 countries in Africa that don't have a single radiotherapy machine, and 29 countries where it's forbidden to import opioid drugs, the drugs which are necessary to give pain control and palliation throughout all stages of this terrible disease. When patients do get access to Western medical facilities, they generally don't have money to pay for the little bit of chemotherapy, the small protocols which may be prescribed. There's a lack of national health insurance plans to pay for this. The situation is quite disastrous. One of the key things which we've been speaking about in World Cancer Day is the concept of unity. And there is nothing more needed than unity with all the institutes and all the advanced technologies which exist in the high resource countries to bring to the benefit of those living in the lower resource countries. This is the challenge. It's a challenge which we just cannot let go by, because there's going to be tens of thousands, hundreds of thousands, maybe millions of people in Africa dying in appalling situations in their country, in situations where it could be avoided, where cancer prevention should be feasible, where presentation with an earlier stage of diagnosis must be feasible, and there must be treatment facilities, at least minimal treatment, for everyone with this disease.
The disparities in Africa that upset me the most by far is the unavailability of pain control. You know, frequently, many cancers are not treatable, but the one thing that we can do, the one thing that we as humans are able to do, is to control pain. In many countries in Africa, that is just not possible. There's not enough trained personnel who know how to administer the pain medications. Some governments actually don't allow narcotics and pain medications to be imported into the country. This is by far the most concerning. Secondarily, as I look at the increase in cancer in Africa, I see a lot of it is due to westernization. It's actually the bad habits of those of us in Western Europe and North America spreading into Africa that's actually worsening and increasing the cancer problem. I'm talking about smoking. I'm talking about increased caloric intake. The obesity epidemic in Africa is starting to take off. And you know, in the United States and Western Europe, obesity and high caloric intake and lack of physical activity is already the #2 cause of cancer, right behind tobacco. I suspect over the next 2 to 3 decades that's going to be true in Africa as well.
If we don't act now, and we're in the middle of a huge disaster, an epidemic, a tsunami of cancer in Africa, if we don't act now, we're just going to be once again too late to react to a dramatic ill health situation on the continent, and will only be available at the end of the story to pick up the pieces when, if we've got a reaction now, we can see the need what to do, and we can bring about the change necessary to alleviate an awful lot of suffering and premature death on the continent.
I think the most urgent actions that need to be taken in regards to cancer in Africa is we need an increase in personnel in Africa who are able to both practice public health prevention as well as do diagnosis and treatment. The number of people in Africa getting cancer is increasing dramatically, and the healthcare personnel who are there now are just terribly overwhelmed. We've got good, very dedicated people who are there right now, but we need more, and those who are there need resources. I would hope that people reading this report or seeing this video would actually help support the organizations that provide those resources to help both prevent as well as diagnose and treat cancer in Africa.
We are very lucky in the West with the support services, with the treatment services, with the treatment availability, with all the infrastructure needed to treat cancer. And all of that is missing in Africa. And yet, these dedicated professionals, the doctors, the nurses, and all the auxiliary staff are doing a remarkable job, but it's a job which needs to be multiplied 100, 1,000, 10,000 times to bring about adequate cancer control, adequate cancer treatment to everyone in Africa who develops this disease.